I'm Vicky Drought. I am a respiratory consultant in Coventry and I'm the lung cancer lead for University Hospital Coventry. So the targeted lung health check is screening for eligible participants, and those people who are eligible are the people aged 55 to 75 who have ever smoked. We are using the GP health records to identify who has ever smoked. So once we've identified the patients, we'll invite them for a targeted lung health check by letter. That letter will give you our telephone number and you can contact us at a time convenient for you to be screened, or we will phone you. So the telephone appointment is going to involve going through a number of questions which are risk factors for lung cancer, including how long have you smoked for and how many you've smoked, but also things like your family history, your occupational history, and your age and gender and other histories of cancer. That's all plugged into a risk score, and if you are high risk, you will be invited for a further assessment with a nurse. So if you're invited for a face-to-face assessment, you will meet one of our nurses at a mobile CT scanner. They will go through your consent for the targeted lung health check screening programme and talk to you about the pros and cons of screening. They will also assess whether you are fit to have a CT scan, or if there are any contraindications to it. The commonest one of which is you've just had a recent CT scan done at the hospital, so you don't need another one. If you are deemed to be suitable and consent to be screened, then you will be scanned on the day. We will also talk to you about smoking cessation if you're still smoking, and can refer you directly to your most local smoking cessation service. The face-to-face assessment is partly to go through your consent with you, and if you are deemed to be high risk and you consent, we will put you through a CT scanner. This is a low-dose scan of your whole chest. It can pick up lots of different things, but the most important thing that we're looking for are early stage lung cancers before you have any symptoms. It can also identify other lung diseases and cancers elsewhere if it's covered by the scan. I think it's really important that you take up the offer for these checks, as I know it's helping me to identify people before they have symptoms of lung cancer. We've seen a huge increase in the number of early stage diseases that we have picked up through the lung health check in Coventry since the start of the programme. If you are identified with early stage disease while you have no symptoms, we're much more likely to be able to offer you treatment and potentially even cure you. If you wait until you have symptoms, unfortunately, we're much less able to offer you cure.